This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Cool. Everyone see my slide okay?
It's on presenter mode on our end, so if you just hit swap displays, it should work.
Swap displays.
Perfect.
Cool. All right. So, all right. Good evening, everyone. Thanks for having us. My name is Kevin Zhang. I'm one of the PGY4s, the current chief resident for this year. So I'm just going to talk to you a little bit about the Tufts PM&R program. All right. So first, Tufts Medical Center. It's located in downtown Boston. It's the primary teaching hospital for Tufts University School of Medicine. It's about 415 beds, 5,000 employees, 550 physicians, and 800 nurses. We have 45 ACGME programs, 19 residencies, plus 26 different fellowships. For our residency program, we have 3 residents per year. We are an advanced program. We're a small but tightly knit group. We have diverse exposure to different practice settings. Tufts is obviously an academic setting. We rotate through the VA extensively, and we do go through several different private practices as well. We have a vast network of alumni, some locally in Boston. We have all along the East Coast down to Florida and all across the country, even to the West Coast. We have strong relationship with our faculty. And a lot of opportunities for mentorship throughout. Our program director and administration are very open to feedback from the residents, and they make changes according to our feedback. We have a lot of one-on-one FaceTime with our attendings and a lot of teaching opportunities and procedural opportunities. So my slides are running away. All right. So our main rotation sites, obviously we have Tufts Medical Center. The other sites that we rotate at is Encompass Health Rehab Hospital, which is about 11 miles north of Tufts Medical Center. And then we also rotate at the VA. West Roxbury is our main site, which is about 14 miles away from Tufts Medical Center. So at these sites, at Tufts, the rotations we usually do there is we have inpatient consults, we do outpatient pediatrics, EMG, we have a spasticity, MSK sports clinic, and pain and spine clinic, and then we also have a tough selective as well. At the Boston VA, at West Roxbury, we have a spinal cord injury floor for ourselves. We do a general rehabilitation rotation. We have amputee and orthopedics clinic. At Jamaica Plains VA, we do a outpatient neurology clinic, and we also do EMG there as well. At Encompass Health, we have our inpatient stroke, our inpatient brain injury, and a spasticity clinic. So where do our residents live? So this is a map of kind of where our residents live right now. It's kind of all around the greater Boston area. We don't have really a restriction on where to live. But a few of us decided to settle in East Boston over here, which is close to the airport, which is over here. We have a resident in South Boston, a few in one in Austin, a few in Cambridge and Somerville area. So generally, we just live close to, access to a highway or public transportation just to get around the Boston area. And for our rotation schedule, during our PGY2 year, we have 4 months of inpatient stroke, 4 months of spinal cord injury, 3 months of traumatic brain injury, and then new for this year, we have 1 month of outpatient MSK in sports. So this rotation is new. It was created given the feedback for the past several years that we wanted earlier outpatient exposure. So that's why for this year, we've implemented this new rotation. During our PGY3 year, we have 4 months of inpatient general rehab, 2.5 months of sports/spine and spasticity. We also have 2 weeks of selective at Tufts, which was new last year during my PGY3 year. That was also based on some of the feedbacks that we gave to our program. We have 3 months of pediatrics and consults, 1 month of EMG, which is at the VA, 1 month of outpatient neurology and spasticity. During our PGY4 year, we have 4 months of EMG, 3.5 months of MSK/ortho clinic, 2 weeks of elective, that can also be an away elective. For example, I'm doing an away elective in the West Coast in a couple months, which you can use, if you're interested in fellowship, and try to go do an elective at where you want to do a fellowship. We have 1 month of ONP, 2 months of pain/spine, sports and spasticity, and 1 month of TBI. So for cost schedule, at Encompass Health Rehab, we have in-house call, ranges about 7 to 8 nights per month. And then for weekends, it's 2 to 3 weekends per 2-month block as a PGY2, and then 1 weekend per month as a PGY3 and 4. And post-call days are off without any morning rounds. So at the VA, there's 2 different inpatient rotations. When you're on the spinal cord injury rotation, we do home call on weeknights. We do about 9 nights per month as a PGY2, less as a PGY3 and PGY4. 1 weekend call per month, and we round on both days in the mornings with the attendings, do what needs to get done, and then it's home call afterwards. And on average, it's pretty light. It's about 1 to 4 pages overnight. And we also cover the general rehab service. Usually only on the weekends. We have nocturnist coverage on the nights. So for weekends, it's 1 to 2 weekends per month, and you round once per weekend, one out of 2 days per weekend with attending. And this can currently be done with the SCI call. So usually if one of our residents is on the spinal cord injury call for the weekend, they'll also do the general rehab. And general rehab is usually really light, 0 to 3 pages per weekend. Our service is pretty small, about 1 to 5 patients, so it's usually pretty light. So at Tufts, it is also home call for nights and weekends. The call is about 15 days per month. Pages are usually really rare. Mainly the ED will page you for any backlift and pump emergencies. And this call is only for during the PGY3 and PGY4 year. So for didactics and learning opportunities, we have weekly protected time on Wednesdays from 8 a.m. to 12 p.m. We usually go by a 12-month cycle based on the topics for the board exam. So we obviously do board review or board practices, grand rounds, journal clubs. We also have ultrasound workshops and EMG workshops. We have dedicated Botox and backlift pump sessions as well. For sports coverages, we do high school sports, high school football. We cover the Boston Marathon. There are other sports coverage opportunities if you're interested. There's some at the VA, there's VA Adaptive Sports Day, and there's some adaptive sports through Tufts as well. So for procedures, we do a vast amount of procedures. We do a lot of spasticity management. So we do a lot of Botox injections, phenol, neurolysis, backlift and pump management, refills, and trials. We do a lot of MSK clinic. We do so trigger point injections, MSK injections, ultrasound guided joints versus nerve blocks, hydrodilatations, and hydrodissections. We do fluoroscopic guided peripheral joints and spine injections as well. Obviously, neural EMGs. We do some wound debridement at the VA, and some other areas that we get exposure to. We do go to a O&P office where we see the fabrication, the casting process, and how they manage the prosthetics and orthotics from their end. Other more advanced ultrasound guided procedures, we do have exposure to 10X and ultrasound guided carpal tunnel release. And some more advanced spine procedures, we see minimally invasive lumbar decompression, which is called the mild procedure. We also see Vertiflex, SI joint fusions, and spinal cord stimulator trials. So for academic activities and resources, we have access to the orthopedic department research coordinator, and she's been very helpful in kind of helping us design our projects and getting through the IRB process. There are several that we're working through right now, and she's been a great help, and she can provide us resources with grants and statistics and get us the things we need to finish our projects. We obviously have access to different library resources, databases, ebooks, journals, etc. So in terms of benefits, here we have the listed salaries for PGY2 to PGY4. Just for your reference, it probably will change by the time you guys start. For vacations, we have 15 vacation days per year, 3 personal days. We do have 5 conference days. For conferences, the program does cover airfare and hotel reimbursements and travel to and from the airport. The program provides us with several Q banks, PM&R, and PM&R Recap is the ones that we got. We have annual education stipend. Last year, it was $350 per residence per year to be spent on books and review materials. And it might change from year to year, but they'll let us know. We also get some discounts for movie tickets, sporting events through Tufts Medical Center. We also get some free software with our EDU account. So we also have moonlighting opportunities. So we can moonlight at Braintree Rehab, which is also part of Encompass. It requires a full license and approval by GME and program director. So this is only for the PGY4s. We also have extraclinical duties at the VA, which is additional coverage shifts for the SCI service, which is also for the PGY4 year only. So there's also opportunity to teach physical exam to Tufts medical students. It's about $50 an hour, and each evening is about 3.5 hours. So it usually starts in November and runs till April of every year, Monday through Thursdays, from 5 p.m. to 8:30 p.m. And this is open to PGY 2s to 4s. So recent graduate fellowships. So we we can see that we match through a variety of fellowships, pain, spine, sports, which is the most popular. We have some SCI and TBI. And we recently also had several residents graduate that just go into general physiatry as well. So that is always an option. So some highlights about our program: we have great spasticity training. You can feel comfortable going straight out of residency and handling spasticity. And the attending will train you well in kind of building and understanding the business aspect of spasticity as well. We have a growing MSK sports and spines faculty, and we're expanding those clinics as well. We have a diverse exposure to different practice settings, academic, VA, private practice. So it gives you a good sense of it gives you a good taste of what is like in each setting and what you want to do after you finish residency or fellowship. We have a lot of one-on-one attending time, and we have a lot of exposure to different type of procedures, and the program welcomes feedback and acts on it. So based on just the years that I've been here, we've made changes to the schedule every year based on the feedback that the residents have been giving. And obviously we're in the Boston area, so lifestyle outside of work, we have the Charles River, you can kayak, you can do a lot of different activities around. Boston is a very historic city, very walkable city. And there's a lot of nature around, short drives away, and very nice hikes. And there's some sports teams that you're so inclined. And then, yeah, very lots of activities to do, lots of higher education around. So a lot of different types of food available and a lot of different activities. So great. Thank you, and we'll take any questions. Let's see. Okay. And this is our contact information, just for information. So you can email us if you have any other questions. Yes, yes, we do. Yeah, the question was, does your program support IMGs? And yes. Yeah, so the unique aspects of our program, I feel like, is just the diversity of the practices that we rotate at, and the diversity of our attendings. So we have attendings that's been practicing for like 20 plus years, that's very well established in the field. and we have new attendings that are newly fellowship trained. So it gives you a nice perspective on your whole career essentially after you graduate residency. If you need help with fellowship applications or in that aspects, we have attendings that are closer to that end, and then we have long-term goals you want to talk about, or like career paths you want to talk about with more experienced attendings, and we also have that. Another unique aspect is our spasticity training. I feel like is very strong, and that you'd be very well versed in that coming out of residency. Does the program provide TY or prelim IM? So we are advanced program only, but Tufts does have medicine. I'm not sure if they have prelim medicine, but I can find that out for you, or you can email our coordinator and we can get you